You're probably wondering why she ended up with this situation. Oops, that is Marito.
Pakilala, gusto, kat ayaw. Okay. Hi, my name is...
She's Maritoni McDio, a jolly yet careless person.
Yeah, I know. But today, I'm gonna show you something. Tell them what I'm gonna show, because you love interrupting me.
She's gonna show you some movement terminologies and how to do it. Let's start! In anatomy, understanding how the body moves is essential for describing the positions and actions of different body parts. Movement terminologies are specific words used to explain the direction, type, and range of motion of bones and joints.
By learning these terms, we can better understand how our body works, how to improve mobility, and how to prevent injuries.
First is flexion. Flexion is movement in the anterior-posterior plane that decreases the angle between articulating bones. The examples are knee flexion and wrist flexion. Extension occurs in the same plane, but it increases the angle between articulating bones, just like shoulder extension and knee extension. Abduction is movement away from the longitudinal axis of the body in the frontal plane. Examples are hip abduction and abduction of fingers.
Moving it back to anatomical position is adduction.
Adduction of the wrist moves the heel of the hand and fingers toward the body, whereas abduction moves them farther away, just like the hip adduction and adduction of fingers. Moving your arm in a loop is circumduction,
Like kung paano kanya pinaikot-ikot.
as when you draw a large circle on a whiteboard. Your hand moves in a circle, but your arm does not rotate. Examples are shoulder circumduction and hip circumduction. Rotation of the head may involve left rotation or right rotation. Limb rotation by reference to the longitudinal axis of the trunk. Examples are vertebral column rotation and neck rotation. During medial rotation, also known as internal rotation or inward rotation, the anterior surface of a limb turns toward the long axis of the trunk. Look at the examples: shoulder internal rotation and lower limb internal rotation. The reverse movement is called lateral rotation, external rotation, or outward rotation, just like shoulder external rotation and lower limb external rotation. Pronation turns the wrist and hand from palm facing front to palm facing back, while supination is opposing movement in which the palm is turned anteriorly. The forearm is supinated in the anatomical position. Now let's move to special movements. First is inversion. Inversion is a twisting movement of the foot that turns the sole inward, elevating the medial edge of the sole, while the opposite movement is called eversion. Dorsiflexion is flexion at the ankle joint and elevation of the sole, as when you dig in your heel. And plantar flexion, the opposite movement, extends the ankle joint and elevates the heel, as when you stand on tiptoe.
But it is also acceptable to use flexion and extension at the ankle rather than dorsiflexion and plantar flexion.
Opposition is movement of the thumb toward the surface of the palm or the pads of other fingers. Opposition enables you to grasp and hold objects between your thumb and palm. And reposition is the movement that returns the thumb and fingers from opposition. Protraction is moving a body part anteriorly in the horizontal plane. Retraction is the reverse movement. Depression. You depress your mandible when you open your mouth, while elevation, you elevate your mandible as you close your mouth.
Another familiar elevation takes place when you shrug your shoulder.
Lastly, the lateral flexion. Lateral flexion occurs when your vertebral column bends to the side, just like the neck lateral flexion and spine lateral flexion. That's all. Thank you for watching. Again, she is Maritoni M. McDio from BSA 110, Professor John Mark N. Nero. As their course specialist of PATHFIT, credit to the owner of Video Effect from TikTok, Cindy's phone, and the pictures from Pinterest.
Bye! Thank you!